arms up overhead, point your fingers towards the ceiling. Great. Now on each of these I'm going to try and move you, and I want you to try and just stay in the position that you're in.
Okay.
Okay, here we go. Awesome, great. And then can I get you to bring your arms back behind you like this? Same thing, I'm going to try and move you. Okay, excellent. You can relax. Okay. And can I get you to bring your arms up overhead and make a Y? Perfect. And I'm going to try and push your arm down, and you're trying to stay as you are. Great. Okay, and then bring your arms to your side. And I'm going to try and pull your arm out, and you just stay as you are.
Okay.
Excellent. Okay, you can relax. Okay, so I'm going to get you to bring your arms out into a T. Great, now try and touch my hand. Awesome. Now I'm going to try and push your arm back and try and stay where you are. Great. Okay, now can you bring your arm across your chest? Awesome. And come up and try and touch my hand. Perfect. Now I'm going to try and push you down, and I want you to try and stay as you are. Excellent. Okay. Okay. Now, can I get you to put your elbows at your side, palms facing each other.
Okay.
And I want you to bring your left palm in towards your stomach. Awesome. And I'm going to try and move you. And don't let me move you. Great. And then rotate your palm back out towards the wall behind you. Awesome. And I'm going to try and move you, and don't let me move you.
Okay.
Awesome. Okay, and you can relax. Okay, now we're going to test your biceps.
Okay.
So put your palms towards the ceiling and bring your palms towards your shoulder. That's your biceps brachii. We're engaging right there, and I'm going to try and move you. Move you. Great.
Not those guns.
And then can I get you to move your arms back down and put your palms towards the floor, and then bring the back of your hands towards your shoulders. Okay, and that's your biceps brachialis. Didn't know there were two, huh?
No.
Okay. And then bring your elbow or your hands back down, thumbs up, and then bring your thumbs towards your shoulders. There's actually one more. This is the brachioradialis. Okay. All right, and just relax. Okay, now this one is your triceps. Go ahead and put your hands on your back like this, and then extend your fingers towards the ceiling. Okay, and I'm going to try and push your arm back.
Okay.
All right, great, relax. Can I get you to bring your elbows to your side with your palms towards the ceiling?
Okay.
And then rotate your palms towards the ground. Great, now I'm going to try and move you. Don't let me move you. Awesome. Okay, now bring your elbows back. Can I adjust you just a little bit?
Okay.
There we go. Perfect. Okay, now I'm going to try and move you.
Okay.
This time don't let me move you.
Okay.
All right, great. And now can you rotate your palms back towards the ceiling? Excellent. And I'm going to try and move you one more time. Alrighty, perfect. Relax.
Okay.
Okay, can I get you to turn your back towards me and lay on your side? Okay, great. Now, I want you to raise your arm up overhead like you're raising your hand to answer a question. Great. Is that as far as you can go?
Mm-hmm.
Alright, awesome. I'm going to try and push your arm down, and I want you to try and stay where you are. Great. Okay. And can I get you to rotate your arm down and around behind your back? Okay, great. Now I am going to support your arm, and I'm going to try and push you down, and I want you to try and stay as you are. Okay, great. You can relax. Okay. Now I want you to try and bring your arm overhead, and I'm going to support you. Try and bring it up as high as you can. Great. Is that as far as you can go?
That can go.
Awesome. Now I'm going to try and push your arm down, and you try and just stay as you are. Great. And then can you bring your arm back down to your side? I'll support you. Excellent. Okay, and I'm going to try and pull your arm out, and I want you to try and just stay where you are. Perfect. Okay, you can relax. I'm going to help you lift your arm up, and we're going to bring it back as far as you can go. Okay. Great, now I'm going to try and push you back, and I want you to try and stay where you are. Okay, great. Now can I get you to bring your arm and don't bend your elbow, but cross your arm across your chest. Excellent. Okay. I'm going to try and move you, and you try and just stay where you are. Awesome. All right, you can relax. Okay. Now I'm going to go ahead and help your arm up, and then I want you to bring your palm towards your stomach. Great. Now I'm going to try and pull you out. Try and stay as you are. Excellent. And then can I get you to bring the back of your hand towards the wall behind you? Okay, great. Now I'm going to try and move you back, and you try and stay as you are. Excellent. Okay, and you can relax. Okay. I'm going to help you lift your arm back up, and I want you to extend your arm out. Great. Okay, and then let's go ahead and rotate your palm out away from you, and then bring your palm towards your chest. Okay, great. And I'm going to try and move you, and don't let me move you. Excellent. Okay, now let's go ahead and bring it back out. Okay, and I'm going to try and push you back down, and I want you to try and stay as you are. Excellent. Okay. Now can I get you to rotate the back of your hand away from me? Great. And then bring the back of your hand towards your shoulder. Awesome. I'm going to try and move you, and don't let me move you. Great. Okay, and back out one more time. Perfect. Now point your thumb away from me. Perfect. And then bring your thumb towards your shoulder. Okay, great. And I'm going to try and move you, don't let me move you. Alright, awesome. And you just relax.
Arteries for any tenderness. I'm going to palpate her lymph nodes, her preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular. I'm going to palpate for her TMJ, so open and close your mouth. Okay. Palpating for any subluxation, crepitus, or tenderness. I'm going to palpate her maxillary and frontal sinuses. Okay. Now I'm going to move on to cranial nerve number 5, which is the trigeminal nerve. I'm going to assess for her motor function. So I'm going to have you cranial nerve 5. I'm going to start with the sensory portion. So close your eyes. Just say yes when you feel this.
Yes, 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 yes.
Okay, perfect. And then I'm going to feel her masseter muscle clench down. Okay, perfect. And then I'm going to test cranial nerve number 7, which is the facial nerve. So I'm going to have you smile, frown, raise your eyebrows up, blowfish face, and a kissy face. Okay, perfect. And then I'm going to go ahead and assess cranial nerve number 8, which is the vestibulocochlear nerve. I'm assessing for her hearing. actually, before I do that, I'm going to inspect her ears, palpating her pinnae and her tragus for any masses or tenderness. And then I'm going to look in her external auditory ear canal. Okay. Okay, now I'm going to assess cranial nerve number 8, which is the vestibulocochlear nerve. I'm assessing her hearing. So I'm just going to have you repeat after me.
50.
Okay.
48.
Perfect. All right, now I'm going to perform the Weber test, which is assessing for lateralization. So tell me if you hear this more on the right, left, or equally bilaterally.
Equally.
Perfect. And now I'm going to test. I'm going to ensure that her air conduction is greater than bone conduction with a Rene test. So tell me if you hear this more on number 1 or number 2. 1, 2. Okay. 1, 2. Her eyes. So I'm inspecting her eyes, making sure that there's no lesions, discharge. I'm looking at her eyelashes, her eyebrows, her sclera, which is white, her conjunctiva, which is pink and moist. I'm going to start by testing her vision. So I'm going to have you hold this chart out, cover one eye, read the lowest line.
LTFPH.
Perfect. Do that same with the other eye.
LTFPH.
Okay, perfect. Okay, now I'm going to assess her pupils. So, look at me. Okay, so they did respond to direct and consensual light. I'm going to assess her retina. So, assessing her red reflexes, looking at the internal structures. My wheel is on 0. Just look straight ahead. Now I'm going to assess cranial nerve number 3, which is the oculomotor, cranial nerve number 4, which is the trochlear, cranial nerve number 6, which is the abducens. I'm testing extraocular movement, so just follow this with just your eyes. Okay. Now I'm going to assess her nose, making sure that it's midline symmetrical. I'm going to assess her for nasal patency. So I want you to just close your eyes, plug on your nostrils, and breathe in, breathe out. Okay? And now I want you to tell me what you smell.
Coffee.
Okay? This is the olfactory nerve, cranial nerve number 1. Plug the other nostril. Okay. Same thing over there. Breathe in, breathe out. Now tell me what you smell.
Okay.
Okay, awesome. Okay. And now I'm going to have you say ah. Okay, I'm testing cranial nerve number 9, which is the glossopharyngeal. I'm making sure that her uvula and her soft palate rise symmetrically, which they do. And then I'm going to test cranial nerve number 10, which is her vagus nerve. So I'm going to have you swallow. Okay, awesome. Now I'm going to assess cranial nerve number 12, which is the hypoglossal nerve. So stick your tongue out. Okay, her tongue is symmetrical. There's no signs of fasciculations. Now I'm going to assess her neck. So I'm going to palpate her trachea to ensure that it is midline. It is. Now I'm going to assess her thyroid. So I'm going to have you look to the left. Look all the way left. And I'm palpating her thyroid. Now to look to the right. Okay. Okay. And now I'm going to palpate her carotid pulse. All right. Moving on. I'm going to go ahead and start with her posterior chest. I'm going to have you stand up and turn around. Face the front. Face the wall. Yep. So I'm going to start by inspecting. I'm looking for any signs of respiratory distress, so refractory breathing, use of accessory muscles, tachypnea, nasal flaring, cyanosis, which she has no signs of. I'm going to start by palpating, so I'm going to have you say 99.
99.
Okay, now I'm going to percuss. Now I'm going to auscultate, so I'm going to start by auscultating her posterior. So you'll just take a deep breath. I'm making sure to listen to her right middle lobe. Okay, now I'm going to test for egophony. So every time you feel my stethoscope, I just want you to say E. Now I'm going to test for bronchophony. So when you feel my stethoscope, I want you to say 99.
99.
Okay, now I'm going to test for whisper pectoriloquy. So when you hear feel my stethoscope, I want you to say 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Perfect. So while I'm back here, I'm going to go ahead and assess for CVA tenderness. I'm looking at her percussing her costovertebral angle. So I'm going to just tell me if you feel any pain, okay?
No.
Okay.
No.
Okay. So you can go ahead and stand up and turn around and face the front. Okay, so with the same thing with, you can go ahead and have a seat. Her anterior chest, looking for any deformities, looking for symmetry, any signs of respiratory distress. I'm actually going to start by percussing, so say 99.
99. 99. 99. 99. 99. 99.
Okay, now I'm going to auscultate. Deep breathing. Moving on, I'm going to go ahead and do her cardiac exam. So I'm going to go ahead and start by listening to, auscultating her cardiac points. I'm going to start with the aortic. So that's the right second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Pulmonic, fourth intercostal space, left sternal border. Mitral, fifth intercostal space, mid-clavicular line. While I'm at the mitral, I'm going to listen for an apical pulse for 1 full minute. I'm also going to inspect and palpate for PMI. I'm going to do the same thing with the Bellmont stethoscope, aortic, pulmonic, Erb's point, tricuspid, mitral. So now I'm going to have you go ahead and
We are going to be testing to see how many blocks you can take from this side to this side. A couple rules is if you pick up 2 at the same time, it's only going to count as 1. If you pick one up and it falls on the floor, it just counts as 1. Don't worry about picking it up. And you have to make sure that the block goes all the way across the wall. And we're going to start with 15-second practice. And then after that 15 seconds, we will start with a 1-minute test of your right side. We'll count and see how many you got, and then we'll do your left side. Okay. Those will both be for 1 minute each, and then we will do the same thing again with your right and your left side for 1 minute each.
Okay.
Okay. Ready?
Mm-hmm.
All right. We will start with our 15-second practice. And go. Okay, stop. Okay. Right. Ready for the real test?
Mm-hmm.
Okay, ready and go. It's okay, so. And stop. All right, let's see what you did. And you only picked up 2 once, correct?
Mm-hmm.
Stupid hand. It's okay. All right. Now we'll do it with your left hand. Ready? And go. Seconds left. And stop. Now we will do it again with your right hand. Okay? Ready? Go. Right, we'll do the same thing one last time for 1 minute with your left. Ready? And go. And stop. that will be all for today. Thank you.
Thank you.